I go to West Africa, where the Ebola virus has killed more than 1,000 people across 4 countries. Liberia, Guinea and Sierra Leone, the worst hit. The Liberian government has accepted its healthcare system simply can't cope with the scale of the epidemic, and it's calling on international partners for urgent assistance. Our correspondent Katerina Vitozzi travelled to Lofa County in northern Liberia, the epicentre of the country's outbreak.
On the move with Lofa County's Ebola contact tracing team. This group of Liberian Red Cross staff and volunteers has tracked down the whereabouts of a woman whose life could be in danger. Mame Kone's husband and son both died from Ebola within weeks of each other. The team want to check she too isn't displaying symptoms of the contagious virus. But Mame's been hard to find, and now she doesn't want to talk.
We feel that when we come to their houses, we are going to report that all of them are Ebola patients. That is the notion they are carrying. And some of them, when they see us, we start to talk to them, they begin to cry.
Mame's not alone in her fear. Vonjama City in Lofa County is one of Liberia's worst-hit Ebola areas. The virus has killed more than 19 people here. New cases are reported daily. But despite that, the county's largest general hospital is eerily quiet. It's taken months of public messaging to get people even to admit Ebola exists.
There are all kinds of theories, or all kinds of schools of thought come about and say, oh, well, people are taking people's kidneys and people are taking blood and we're spraying people to die. But now we have graduated from that. People have come to accept it, that yes, it is indeed Ebola.
It's hoped that acceptance with time will lead to patients seeking professional medical help.
We are taking you to our holding center. Any patient who is suspected of Ebola, well, we're going to be holding them until they get transferred to the case management center in Foya.
This United Nations-funded centre will soon open.
That's the entrance for the patient entrance. This one of the rooms where we'll have suspected cases of Ebola.
After tests, confirmed cases will then be driven to the county's only treatment centre, Foya, a 2-hour journey via a bumpy dirt road. It's northern Liberia's biggest Ebola case management centre. The disease has no known cure, but prompt supportive care greatly increases the chance of survival. But at the moment, there are more patients than this clinic can handle. Aid organisation Médecins Sans Frontières funds the centre and is helping build more room. It's urgently needed.
We have been crying, asking the international community to really come in to support the centre, to support the Ebola fight in Liberia, because the government all alone cannot do it.
Capacity isn't the only challenge. MSF funds this centre, but it's staffed by Liberian healthcare workers, and finding personnel is tough. If the right precautions aren't taken, getting close to infected patients can be fatal. More than 35 Liberian caregivers have died since this outbreak began 5 months ago.
People refuse to come because they say it was a dangerous job. It's a work that is hard, that people not even willing to do it. Only like people who think that they have, they are people at heart. They have their people at heart. They say, okay, but then we are willing to go help.
Beyond this blue door is the clinic's high-risk zone. It's where suspected and confirmed Ebola patients either recover or die. Harrison Sikila was one of the lucky ones, but 7 other members of his family infected at the same time didn't pull through. He's surrounded by sad memories here, but he decided to stay on at the centre and work as a security guard.
Why mostly I decided to come back here is to tell the other people who come in, as any time they come here with fairness, I will try to counsel them, to tell them how to cool down their mind, that they should keep courage, they will get well. And like even in the night, when any patient come here, they will meet me and I will really talk to them and I show them that I'm one of the patients, so I will keep them courage.
Foya is a place of great tragedy mixed with courage and hope. We are outside the high-risk zone in the disinfection area when a nurse arrives with good news.
They were positive. Now they are negative.
One of those females is 7-year-old Jeniba. She washes off the high-risk zone, takes her first free steps outside in nearly a month, and manages a tiny smile.